Here is a comprehensive and detailed overview of diphenhydramine. 1. Basic drug information, generic name diphenhydramine. Drug class, first-generation antihistamine, anticholinergic, antiemetic, and sedative. Drug forms, oral tablets, capsules and liquid, injectable solution, topical cream or gel, oral dissolving strips. Brand names, Benadryl, common OTC brand, Somanex for sleep aid, Nitol, Sleepinol, Unisum, some variants, generic store brands, e.g. Walgreens Diphenhydramine, CVS Sleep Aid. Shasha 2. Definition. Diphenhydramine is a first-generation antihistamine primarily used to relieve symptoms of allergy, hay fever, and the common cold. It is also used for motion sickness and as a mild sedative. Mechanism of action. Diphenhydramine blocks the H1 histamine receptors in the body. This action reduces the effects of histamine, a chemical responsible for allergic symptoms, crosses the blood-brain barrier, leading to sedative effects, has anticholinergic effects, which contribute to drying up secretions and causing drowsiness. #4. Indications. Diphenhydramine is indicated for allergic reactions, e.g. hay fever, urticaria, rhinitis, anaphylaxis, adjunct to epinephrine, motion sickness, insomnia, short-term treatment, cough and cold relief, Parkinsonism, drug-induced, nausea and vomiting, itching and skin irritation topical. 5. Contraindications. Do not use diphenhydramine if the patient has known hypersensitivity to diphenhydramine or similar drugs, neonates or premature infants, breastfeeding use not recommended, use as a local anesthetic, narrow-angle glaucoma, symptomatic prostatic hypertrophy or bladder neck obstruction, risk of urinary retention. 6. Before taking this medicine, precautions. Discuss with your healthcare provider if you have glaucoma, asthma, COPD, or other breathing problems, liver or kidney disease, enlarged prostate or difficulty urinating, heart disease or high blood pressure, thyroid disorders, pregnancy or breastfeeding. How to use. Oral use, take with or without food. Measure liquid forms with a dose measuring device. Topical use, apply a thin layer on the affected area. Do not use on broken skin or large body areas. Injectable, administered by a healthcare professional, usually intramuscularly or intravenously in emergency settings. 8. Dosing information. Adults, allergic reactions, 25 to 50 milligrams every 4 to 6 hours, max 300 milligrams per day. Insomnia, 50 milligrams at bedtime. Motion sickness, 25 to 50 milligrams 30 minutes before travel. Topical, apply 3 to 4 times day. Children, age 6 to 12 years, 12.5 to 25 milligrams every 4 to 6 hours, max 150 milligrams per day. Age 6 years, use only under healthcare supervision. 9. Missed dose, overdose. Missed dose, take as soon as remembered. Skip if it's close to the next dose. Overdose symptoms: extreme drowsiness, confusion, blurred vision, dry mouth, seizures, hallucinations, fast or irregular heartbeat, respiratory failure. Seek emergency help immediately in case of overdose. 10. Stop or avoid taking. Stop use and consult a doctor if you experience difficulty breathing or swallowing, you have a rash or worsening condition, symptoms persist, 7 days or return after disappearing, using other sedatives, alcohol, or CNS depressants. Side effects in detail: common, drowsiness, dry mouth, nose, or throat, dizziness, constipation, blurred vision, coordination issues. Serious, confusion, especially in elderly, urinary retention, irregular heartbeat, seizures, allergic reaction, rash, swelling, difficulty breathing, paradoxical excitation, especially in children. 12. Vital information: can impair thinking and motor skills, avoid driving or operating machinery, increased risk of side effects in elderly due to anticholinergic burden, delirium, falls. Not recommended for routine use in children under 6 years without professional supervision. Do not combine with alcohol or other sedatives. 13. Other drugs that will affect diphenhydramine may interact with other CNS depressants, e.g. benzodiazepines, opioids, alcohol, MAO inhibitors, e.g. phenelzine, isocarboxazid, contraindicated, anticholinergics, e.g. atropine, scopolamine, tricyclic antidepressants, e.g. amitriptyline, muscle relaxants, sleep aids or other antihistamines, Risk of overdose. Always consult a pharmacist or doctor before combining with other drugs. Thank you. Have a nice day.